Okay, I've got all your props. So, I know I've got my arms full of all kinds of things. So, real quick, don't forget on Wednesday next week, have a practical over the bones that you did. So the bones that you did for the lab that I took pictures and you had to label the parts of the bones and you have that packet to be doing. You have a test over those on Wednesday next week, okay? So make sure you are doing them. My advice is to be working on them a little each day. So like today, study and learn everything in the arm. Tomorrow, learn everything in the head. Like review arm and add the head. Monday, do review arm, head, and learn the leg. Tuesday, review those and learn the torso. And then you're ready for Wednesday. Because if you don't do a little each day, it's going to be really, really difficult. Okay. So make sure you are learning them a little each day. Your test is timed. And I'm giving you the same amount of time that we have in class. My in-person kids don't get to use their notes. I can't monitor you on that. I would recommend you learn it without your notes. Don't depend on them because it's timed. Plus, having a practical experience and doing that is something you're going to have to do in college. So it's preparing you to practice and work on that now rather than getting to college and it being the first time. So just, study and plan on that, but do a little each day. I tell you guys, like in person all the time, it's like an elephant. If you eat how to eat an elephant, you eat an elephant one bite at a time. It's big, it's overwhelming, it's huge. You get overwhelmed with all the different things going on, but break it down into little bites here and there, like one thing at a time, and then you can get it accomplished. So with your skeleton, that's my tip. At a time, do arm one day, head a day, leg, torso, and you're ready. And yes, your test is on Wednesday next week over the bones. And then you have a test on Thursday that's going to be the written test over your notes like what we normally do. So these are two separate test grades, not 50-50, two complete test grades, okay? So definitely be looking at that ahead of time. Okay, so let's talk joints. Joints are anywhere, or articulations, right? Arth is a word you already know. Anywhere two or more bones come together. And their function is to hold the bones together securely and give mobility. Some of them, right, are for mobility. But others are just holding the bones together. So like even in my ankle here, like this is my mobility, but I also have a joint between my tibia and fibula. And I've got a joint there, so I've got fibers holding it together securely. This is another joint. This is your distal fibular tibia joint. You have the same thing in your arm between the distal radius and ulna. You've got joints between the bones of your skull. I don't know if you can see these. Do you see these? See those little squiggles there? Okay. Those are sutures where the bones of your skull have grown together. And you saw this in the pictures I sent you. So that's what joints do. It's holding the bones together and then giving mobility. Classification, we can classify them in two ways, either by their function and what they do, like how much they're able to move, or by their structure, which is what they're made of. Now remember, structure and function go together. So these are going to seem very similar, but you have to look, okay, am I talking about the structure or am I talking about its function? But they do go together. So the things that structurally are fibrous and don't allow for movement are functionally immovable joints. So again, those go together. So don't let that confuse you. So your functional classification, you have synarthroses. Those are your immovable joints, so they don't move. Amphiarthroses are slightly movable. So synarthroses, that's like these here in the skull, right? You started as a bunch of different bones as a baby, and over time they grow together. And you have immovable joints. Amphiarthroses, that's like your vertebra. You're like, my spine moves a lot. It does all together. But if you look at these individual little joints, this joint only moves, right? This right here only moves just a little bit. All together, it allows for a lot. But individually, these only move a little bit. So those are amphiarthroses. And then diarthroses, that's like your big movable joints you normally think of. Structurally, this is how they're made. Some of them are held together with fibers, so we call that a fibrous joint. And those are typically immovable. Again, structure determines function. Cartilaginous joints, cartilage got a little more give to it, so those are slightly movable. And then synovial have their whole own design. So your fibrous joints, we're going to start with them. These are held together with fibers, a fibrous tissue. There's some of them. So the sutures in your skull, this is, like right here, we talked coronal suture, where my frontal and parietal bones come together. I've got a sagittal suture. Remember, sagittal cuts you left and right. That's holding my parietal bones. So that's why as a baby, these are all smaller bones. That's why babies have soft spots, right? Because it's the fibers holding them together. Because the baby's head has to squeeze. So when you're pregnant, baby, get in my picture. Baby sits here and the baby's skull has to squeeze down through here, through this pelvic cavity. So that's why there's multiple bones, so they can squish and squeeze. That's why the babies come out with like cone heads, because the bones had to squeeze that way. And then afterwards, it goes back and the fibers are holding it. And then as you age, they will grow together into these sutures. And these sutures actually grow together at different ages. So like when they find a skull, they can look at these sutures to help determine the age of that person, which is really interesting. Syndesmoses, that's going to be like these down here, these fibers down here, right, that we said. So this doesn't move, holds in place. You also have another one called gomphoses. Gomphoses are what hold your teeth into your mandible. You have little ligaments. They're called periodontal ligaments. Peri means around, odont being teeth. So periodontal. So they're ligaments around your teeth that hold your teeth into your mandible and hold your teeth securely. So those are gomphoses. So there's lots of different immovable joints in your body. Our second type are cartilaginous joints. Those are held together with cartilage, shocker. And so you're going to have those in places such as right here, your pubic symphysis. I don't know if you can see there's cartilage right here, holding these two pubic bones together. Okay. And again, it's slightly movable. It's not one you normally think of, but again, especially birth has some movement. These intervertebral joints, remember means between. So between the vertebra, you could see the cartilage discs. And I hope you remember that's a fibrocartilage tissue making up these discs. Again, giving it a little bit of movement, a little bit of give. And then the epiphyseal plate that we talked about yesterday, or you saw in your notes yesterday, with the plate between the bone, that's basically your growth plate and where your bones grow in length. I'm realizing you don't have a video explanation, so I'll record one for your skeletal system notes and get that posted. Okay. Right. Synovial joints. Synovial joints are unique. These are movable joints. lots of movement. So this needs lots of support. So there are 4 distinguishing characteristics. One is the articular cartilage. So that's the cartilage here on the very end of the bone itself. You saw this in the chicken wings. It was that super white, shiny material on the end of the bone that makes it nice and slick. You're going to have that on the end of all the bones for synovial. You have fibers. This is a knee joint. You have fibers around here encasing it, so that you create a cavity on the inside that holds synovial fluid. Synovial fluid kind of is like egg whites. So it's watery, but a little like jelly and slickness to it. And again, that's just absorbing friction. And so you're preventing friction between the bones. And then because of there being so much movement going on, you have all these ligaments on your bones holding everything in place. So like with this knee joint, even if I take off my patella, I still have this lateral ligament. I have a medial ligament. I've got ligament, right? This is that ACL and PCL, your ACL here in the front, your anterior cruciate ligament in the back. You have a PCL, your posterior cruciate ligament. So lots of things give stability to synovial joints. Other things in synovial joints that help out are bursa. If you know bursa from your word list, bursa is a wine skin, so that's basically a sac of fluid. And again, just acts as cushioning and preventing friction. A tendon sheath is if that's elongated to wrap around it, wrap around the muscle, giving it protection. And that you can see as a picture of like your, here's your tibia, femur, fibula. So here's your patella. You have a little bursa here. Again, just helping out with it. So there are actually 6 types of synovial joints that we're going to look at. Gliding or plane joints, hinge joint, pivot, condyloid, saddle, and ball and socket. I really like these diagrams. You can actually see kind of the diagram version and then what it looks like in real life in the body. And so you'll actually see these again on your test. So definitely be sure you study them, that it's like, okay, here's what it is, you know, in a diagram, here's what it looks like in real life. So plane joints, this is where the surfaces are flat and they're basically just sliding past each other. That's why we call it a gliding joint or a plane joint. You can see these in your feet, right? Because your feet kind of change shape a little. Like they can be like real flat and they like, these bones have to slide past each other. Like when you're walking, you don't have just your ankle. Like if you're barefoot, your foot kind of maneuvers and around whatever you step over. And so these bones slide past each other to do that. You get the same thing in your wrists. Your hinge joint, this is where you have the cylinder one goes into the trough of another. So like if I look at my humerus, I have the cylinder down here called the trochlea. And then on my ulna, this notch is called your trochlear notch. So it's kind of a trough. So the cylinder one fits into the trough of another. And that's how it's able to rotate around for your elbow movement. So notice it's uniaxial. It's only moving in one direction. So this is your hinge joint. You get the same thing in your elbow. Pivot joint is, you find my, oh, I didn't bring that bone. I didn't bring that bone at all. Sorry. But your radius has that rounded head to it. And then on your ulna, there's a little sleeve right here where the radius sits. And so it can rotate this way. And you get a pivot in your elbow. So your elbow actually has 2 joints. You have your hinge joint doing like this, but then you have a pivot joint between your radius and ulna. And that's what allows your hand, let me make sure you're in my, I'm in screen, right? This is what allows my hand to do this way. I can pivot over and under and keep my elbow straight because I have that pivot joint at the proximal radius and ulna. So proximal radial ulnar joint. You also have one in your skull. You actually have two. You have one joint letting you do this, and then you have a second joint between your C1 and C2 that lets you do this and rotate around an axis. So that's another pivot joint. Condyloid is where kind of the egg shape, you can see here, this egg shape of one fits into like a concave of another. And this gives you two movements. It's biaxial. So this is like your knuckle. Not here. This is a phalange. This is your knuckle. And you get two movements here. You can do forward and backwards. And then you can also do side to side. So all of these is just kind of a combination of that forward, backwards, and side to side. So that's a condyloid joint. The joint right here, your TMJ, which is temporal mandibular joint, is also a condyloid joint. Saddle joint. See how this looks like a horse saddle? And this looks like an upside down horse saddle? Okay, that's a saddle joint. You can see it right here between your carpometacarpal. So carpal is your wrist, metacarpal is down here. So you can see how there's a horse saddle here, right? And then another upside down horse saddle. And so this is what lets you go forward and backwards and side to side. So it's biaxial. You get two movements out of it. And then ball and socket, this is everybody's favorite because this is the easiest, is a ball and a socket. So you can see the ball head of the femur in the socket of my hip bone. And so let me hold this properly. So, let me turn this way. So ball in a socket, so you get forward and backward. I get side to side. And then I also get rotational. I can rotate forward and backward as well. So same with your hip. If you stand up, you can do this. Let me see if I can get it in my view. You can lift up, right? Forward and backwards. I can go side to side. But I can also rotate as well. I got a little rotation dance going. Get your shimmy and shake on. So that's a ball and socket joint. Some problems you can have with your joints. One is a dislocation. That's where, like, if you dislocate your hip, this head comes completely out of this joint cavity. That's a problem. Shoulder, same thing. Instead of this humerus being in this cavity with my scapula and clavicle, it dislocates and is completely out. That's a problem. This is a picture of that from one of my former students. She was a water polo player. This is normal. So here you can see, here's her clavicle, here's her scapula, and there's where the humerus should be. There's the socket. Instead, it's way down here. So it was dislocated. It was forced out of its socket. That's bad. Some people can do this voluntarily. Like I can do it. I can only do it with my thumb and pop it in and out. Double jointed is not a thing. You don't have extra joints or extra bones. It just means your ligaments are longer. And so that bone can move more easily and it can move more than it normally does. And because of that, it goes in and out of the socket. So if you're double jointed in any way, it's because of your ligaments being longer and more flexible, not because you actually have extra joints. And bursitis, this is an inflammation of that bursa. You've probably also heard tendonitis. And again, that's that repeated motion, like baseball players get it in their shoulder, swimmers, right? Tennis, elbow, stuff like that. It's that repeated motion. A sprain, this is where the tendons and ligaments are stretched more than they would. Have you ever heard people say that it's better to break a bone than to like sprain your ankle or something? It's not necessarily better, but bones do heal quicker because bones, they're living tissues. They have blood supply, they have nerves, they have all that stuff. And because they have a very rich blood supply, you've got oxygen and nutrients coming to help repair it. And we'll talk about repairs on Monday. But like strains, those tendons and ligaments, those are avascular. So they don't get a blood supply on their own. So they're depending on diffusion. So they get those nutrients and things less. So that's why those take longer to heal than a broken bone does. And then arthritis, arth being joint, itis, inflammation, that's inflammation of your joint. And that could be any number of things. You can get rheumatoid arthritis, where your body's just attacking your joints. You can get osteoarthritis, which is where they've worn out, but it's from use, all kinds of different things. So that's the main things from your notes. I've got some other quick things in here like dislocation. This picture is kind of cool. This is a kid who had a knee reversal. So when he's either 10 or 12 here, he had bone cancer in his femur. And so to take this out, they didn't want this, 10-year-old kid to lose his knee and ankle joint, right? Like that would very much limit your mobility. So instead of losing all those joints, they took cut this off, took the tibia and reattached it backwards. So now this foot is moving forward and backwards just like the knee. So he still wears a prosthetic on the lower half, but the brain is young enough that it can like rework and rewire and figure out how to use it forward and backwards just like the knee. So he still maintained a lot of his mobility. So it's just fascinating and amazing that we can do these kinds of things. So, and then just some other like videos and sites and stuff if you want to check them out. All right, stop sharing. That's it. So, your assignment for today is you're going to make a video on joints. So you're going to make a video on joints. On Canvas, there's an assignment. There's a whole list of things I want you to include. Now, if you're talking about the skull or hips and you want to like insert a picture and talk about the sutures and stuff, that's fine, because you can't show that, you don't see your sutures. But when you're talking synovial joints, I want to see you in the video showing me your synovial joints, showing me your directions of movement, okay? You can use clips, which is really easy. Like you have to play with it a little, but it's super easy. But if you have another video app that you just love, that's totally fine. You can do the video, you can upload it to your Google and submit the link. That's fine. Whatever one is, I don't care. I just want a video of your joints and things. So there's a rubric, which is just like the instructions. So I'm going to follow the rubric, watch your video, and I'll just click yes, yes, yes on the things I see. So some of it's questions, so just tell me and answer those questions in your video. But I definitely want to see you moving around, showing me all those synovial joints, okay? If you are not in it, I'm taking off points. I want to see your faces. You see mine all the time. I don't get to see yours. Some of you did it for your PSA, which I enjoyed, and I loved getting to see you. This is always like a one-way conversation, so I like getting to see you as well. So that's your assignment for today. I am extending the deadline till Tuesday. This is a new thing we're trying out. We normally do a different assignment, but so it takes a little longer than I like the 30-40 minutes I had planned. So I'm going to extend the deadline, just so you know, until Tuesday next week. Okay. Because Monday we'll talk fractures, Tuesday's review, Wednesday's your bone practical, Thursday is the written test. The quiz we normally do on Thursdays, I'm going to bump that to Friday. I'm not going to have you do a quiz and a test all in the same day. So don't worry about it. That quiz will move to Friday, okay, when we start muscles. All right. I hope that's good. I hope that helps. If you have any questions, let me know. And don't forget to do that daily check-in. Okay, bye, guys.
What about the